Thank you for joining our webinar today. I'm Ferris Taylor, Executive Director of the Healthcare Executive Group. Today's discussion topic will be led by SureScripts, one of our HCG Gold Technologies partners, entitled, "We Can Stop Diseases, but Can We Stop the Facts?" As you can tell by the title, it will be both an entertaining and an informative webinar, and we appreciate your interest and engagement. So again, welcome. As background, HCG is a national network of executives and industry leaders celebrating our 31st year and working together to improve and reshape healthcare. We interact regularly across multiple channels such as these monthly webinars, periodic executive leadership roundtables, white papers, digital media, newsletters, and our annual forum each September. By facilitating these frequent interactions, we provide a platform for networking and for industry thought leadership. You can learn more about how we convene and facilitate healthcare executives by going to hcg.org. Next slide. Throughout the year, culminating in our annual forum, our members discuss and debate critical issues, challenges, and opportunities in healthcare. We then formally vote and rank a set of HCG top 10 priorities for the coming year. Today's webinar will focus specifically on our 2019 HCG priority number 6, rising pharmacy costs, as you see here. But today's webinar will also touch on several other critical challenges, including but not limited to number 1, data and analytics, number 10, cybersecurity around privacy and security, and even number 8 on operational effectiveness. The SureScripts team and their experience with health plans, providers, and partners are industry thought leaders on these and other HCG top 10 issues, as you will hear today. To facilitate today's webinar, let me turn the discussion over to Melissa Warnke, SureScripts Director of Marketing, to introduce herself and provide some webinar instructions to facilitate today's panel. Melissa?
Thank you, Ferris, and good afternoon, everyone, and welcome to today's webinar, We Can Stop Diseases, but Can We Stop the Facts? As Ferris said, my name is Melissa Warnke, and I'm the Director of Marketing here at SureScripts. I am lucky enough to be the host of the webinar today, and as Ferris mentioned, I wanted to note a couple logisticals. You are all on mute, and so as you have questions throughout today's webinar, please put those in the chat box, and we will take questions at the end as they come in. So again, as I said, my name is Melissa Warnke, and I'm the Director of Marketing here at SureScripts, and I'm focused on the pharmacy, PBM, and health plan markets. I've worked in healthcare for over 15 years, including time in supply chain, medical devices, and health information technology. I hold an MBA from DePaul University, Kelstat Graduate School of Business, and a BA in Finance from the University of Illinois at Urbana-Champaign. I'm pleased today to be joined by two colleagues, Ashley Fifield, who actually unfortunately is unable to join us today. She's the Vice President of Key Accounts here at SureScripts, focused on our health plan markets, and you will see her email address at the end of this presentation. So if you have any follow-up questions that we can't address today, please feel free to reach out to her. And then I am pleased and honored to be joined today by Jeff Spinagle. Jeff is the Chief Technology Officer here at SureScripts with more than 20 years of experience in the healthcare technology industry. He was previously the co-founder and CTO of Cryptic Corporation, a provider of secure healthcare information exchange platforms. Jeff has a BS in electrical engineering and computer engineering from Purdue University and has extensive experience in both hardware and software design, network engineering, and information security. So I am pleased to have you all and to jump right into our conversation. So let me start first with a little bit of a history lesson. So in 1843, the fax machine was first invented. A few short years later, in 1876, the telephone was invented. Nearly 100 years later, in 1969, the internet was first invented. And in the early 2000s, the first electronic prescription was sent. We have made unbelievable progress in the 20th and 21st century when it comes to technology. But we all know technology doesn't happen or become ingrained in our lives overnight. Perfect example of that is electronic prescribing. So in 2004, only about 4% of physicians had actually adopted electronic prescribing. It wasn't until 2007 that all 50 states had even made it legal to electronically prescribe. By 2010, 326 million e-prescriptions were sent annually. And in 2018, that number had risen to 1.91 billion electronic prescriptions. At SureScripts, we believe that in the next few years, virtually all prescriptions will be sent via electronic method. So that's nearly 20 years to get to today. And so we know technology doesn't change overnight. But 175 years later, the fax machine is still used billions of times a year to ultimately deliver patients their prescriptions and healthcare in general. I want you to think about what 175 years has meant to society, to your lives, to healthcare. Think about the vaccines that have been invented that have helped, frankly, eradicate or greatly reduce diseases in that same timeline. Things like polio, yellow fever, tetanus, even chickenpox. Diseases like juvenile diabetes have become chronic. And in my lifetime, HIV went from being a death sentence to being a chronic disease. And yet, 175 years later, we still use the fax machine every day to communicate all kinds of patient information. But it's not just the irony that we use 175-year-old technology in 2019. There is a real cost to using the fax machine. So it is estimated to cost about $250 billion a year to process the over 30 billion healthcare transactions that happen every year, half of which happen via the fax machine. It's also estimated that about 75% of patient information is sent via fax. And there are so many ways that a fax machine can go wrong. Information can be sent to the wrong number. The wrong person could pick that information up off the machine. Somebody could scan or upload that information to the wrong patient chart. There are HIPAA data breaches, and there are security issues. In fact, the largest fax HIPAA fine issued in 2017 was for $2.5 million for faxing information to the wrong number. So there's a lot of cost to the fax machine, but it's also unreliable. Fax machines have busy signals. Information has to be resent. There's information that's just frankly never received. In fact, it's estimated that about 30% of tests have to be reordered because the results simply cannot be found. And fax machines are inefficient. We have members of our industry who spend time during their day printing, scanning, and attaching documents from a fax machine to electronic patient charts that now contain unstructured and unusable data that can't flow correctly into the EHR. CMS Administrator Seema Verma called for the end of the physician fax machine by 2020, which is a short time from now, and I don't think we're going to achieve that lofty goal, but it is a goal that I would encourage our industry to continue to push towards as we work to eliminate the fax machine. Because not only is it unreliable and expensive and inefficient, but it is an avenue to hack entire networks. The researchers at Checkpoint Software Technologies warned that cybercriminals can exploit vulnerabilities found in all-in-one printer fax machines to hack entire company networks. But this isn't just about our inefficiencies or the cost that it adds to healthcare. Your members feel it. They spend time on the phone requesting records be faxed to other providers, picking information up by hand and delivering it so that they ensure it gets to their next prescriber. And they do all of this while they wait on care and potentially avoid that care altogether. So let me tell you a little personal story. So I am an introvert. I've probably taken 20 plus personality assessments over my career. And that is the one characteristic that all of them have in common. And there are lots of traits that introverts share, but one of them often is our despise of making phone calls, which is absolutely a trait of mine. I will do anything to avoid making a phone call. I have scoured the internet for email addresses, for chat boxes. I've found physical mailing addresses where I can mail in a piece of paper, all to avoid making a phone call. And to be honest, I've delayed a medication refill because I didn't want to have to deal with the phone. And thankfully for me, that's just my allergies. So I don't have a big consequence when I don't take my allergy medication for a day or two, but there's always consequences. That's why we take prescriptions. So for me, if I don't take my allergy medication, it inevitably turns into a sinus infection, which means I have to go to my doctor, I get a prescription, I have to go fill it at my pharmacy, and I'm just frankly miserable for about a month, all because I didn't want to pick up the phone and call my doctor and my pharmacy and figure out why my prescription wasn't being refilled. And frankly, in today's world, I shouldn't have to make a phone call as the patient. That should be something that really, as a member and as a patient in our healthcare organization, we have that figured out without having to pick up that phone and ask for faxes and other technologies. So how do we really solve this problem? Well, at SureScripts, we believe that one of the ways that we can do that is by tapping into and improving the use case of existing platforms like the EHR. So one last quick history lesson. With the development of the electronic medical record system in 1972, there were a number of key benefits that were expected. It was expected to minimize errors from handwritten notes, to really maximize cost efficiency by consolidating this information into one spot and making it shareable, by enhancing coordination across various healthcare providers who could instantly exchange information and decrease lost paper. And I would say that while we have improved, we all know that the EHR system alone was not the silver bullet. But what we also see is that new technologies are continuing to improve the EHR's ability to eliminate the fax machine. And we're really excited about that possibility. So I wanted to dig into 3 technologies that we're supporting here at SureScripts that we believe are helping to reduce faxes. So the first is real-time prescription benefit. So real-time prescription benefit, again, is in workflow in the EHR. That's really important for adoption with prescribers. It is a seamless, intuitive access to patient information, patient benefit information that's really in real time. It's a neutral solution where patients aren't steered off formulary or towards specific medications by outside interests. It provides pricing and coverage data for therapeutic alternatives and pharmacy channel options for those patients. And it shows coverage alerts such as prior authorizations or step therapies. All of this in workflow at the point of prescribing. And one of the great parts about it being able to show coverage alerts is that it leads seamlessly into the next technology I wanted to highlight, which is electronic prior authorization. So again, electronic prior authorization exists in the workflow in the EHR. It's a fully electronic prior authorization process in the e-prescribing workflow. I mentioned it in the real-time prescription benefit part that we do highlight to prescribers the ability to choose an alternative that's clinically equivalent, but that maybe doesn't require a prior authorization. And when we give that information to prescribers, we see habits change. And so about 28% of the time, a prescriber will change the medication they're prescribing to one that doesn't require a prior authorization, avoiding it altogether. But when a drug that is the right clinical and financial decision for that patient does still require a prior authorization, electronic prior authorization provides a dynamically tailored question set that is specific to that patient and plan, and it has an automated response that often is delivered within about 60 seconds. So the last technology I wanted to highlight was direct messaging. At SureScripts, we call that our clinical direct messaging solution, and it is a direct communication among more than 596,000 healthcare professionals. It is simple, it's secure, it's a standards-based way for all members of the healthcare team to exchange health information about their patients. It includes the ability to efficiently sort and handle time-sensitive communications, and it's designed to maximize incentives and avoid regulatory penalties. These are just three of the ways that technology is enhancing the EHR experience for prescribers and really helping them to make these decisions and to move healthcare forward within their workflow, all of this advancing towards our goal of really eliminating the fax machine. Because at the end of the day, when we bring everything to the prescribers in their workflow, the ability for myself, yours, and your members to get the right prescription for them, both clinically and financially, the first time improves that experience. And as an added benefit, we as an industry avoid the billions of faxes that are flowing across our industry every year. So as we discussed at the beginning, the fax machine has a lot of challenges, one of which it is not secure. But we all know that new technologies are not immune to safety concerns. There are industries across the globe, frankly, that work every day to keep electronic information safe and secure. So for the rest of the webinar, I'm going to turn it over to Jeff to talk us through a case study of how healthcare IT can be built to be reliable, secure, and scalable. Jeff?
Thank you. As Melissa mentioned, we're going to talk a little bit about a case study of the SureScripts network and a little bit about the technology and some of the foundations that go together to make a network that is reliable, secure, and built to scale. So you can go to the next slide, Melissa. So this slide has a diagram on it with these 4 layers and a bunch of boxes. And the idea of these boxes and the layers is sort of to represent some key functionality that sort of resides inside of the SureScripts network. And in a way, this sort of describes these are all of the things that you have to have in a network to make a great network that can handle the kind of data you do in healthcare. And so there's a lot of little pieces that go together, and they all weave together to make a network. And then really underneath all of this are the pillars of technology to make it possible to be reliable and secure and built to scale. So we'll start with the lowest line there, the trust fabric. And if you're going to use a network to transfer healthcare data, you want to be able to trust that network. If you're going to have something that your business is important to your business, you want to trust that the networks can work as you expect. And that first box in the trust fabric is the privacy. And privacy is pretty straightforward. It's a lot of technologies are things like encryption and authentication. And those are all the things we do to make sure that the data that you put on the network is secure and is only seen by the people that it should be seen by and not seen by people that it shouldn't be. Information security is sort of an add-on to privacy, and that is primarily focused around all of the certifications and the processes that sort of contain the network to make sure that not only is it secure today, but it's secure in the future. So that includes things like SOC certifications, which are certifications that you follow common best practices on how a network works. And all that's really important to know that the privacy we have today will be there tomorrow. But the last box, governance, is in some ways the most important of all of the parts of the trust fabric, because that is about a set of rules that all of the participants of the network agree to follow. If you're going to join the network and send data across the network to other people on the network, you want to know that all of us are running on the same rules and that we as a network enforce those rules. And those rules provide assurances that there's not only privacy within the network, but once your data gets to where it's going, that privacy is maintained on the other side. And so governance is really a key part of having a trust fabric. Not only do you trust the network, but you trust the people that are on the network to do the right thing. So the next layer is a transport layer, which of course it's a network, and so it transports a really key part of what a network does. We transport data from A to B, and there's a lot of little parts of it that make transport possible. The first box, the idea of provider directories, is simply the ability to find other providers. Having a great provider directory enables you to locate places where you want data to go. We mentioned the direct protocol earlier as a method of communication between physicians. And again, that directory is the way you can find other places for data to go. So record location is a way for you to find records that exist within the network or on other people connected to the network that were we are very actively involved in those standards, and those standards are really the core of how you talk to and use the network. And those standards evolve over time, but in general, they're relatively slow evolving standards that everyone uses. So workflow integration is really about providing a way for people when they get a message or they send a message to have it happen within a usable workflow. And that could include things like integrating with an EHR or with a pharmacy system. And the real key there is to make it possible for these transaction standards, they're going to move data to actually make the data arrive in a way and a place that's actually useful. The patient matching is all about being able to find patient identities across all of the data on the network. If you're going to do record location, the patient matching system is a great way to find a common identity for that patient. And our patient matching index is almost 250 million patients, so it's a phenomenal index. The last one, the APIs, is really the most forward-looking of all of the boxes on that transport layer because it's about having application interfaces that you can write to do new things. In other words, as you come up with new transactions you want to do, these APIs allow you to sort of extend the network beyond what the really core transaction standards do. And the APIs really represent the future of the transport layer. As more APIs come into being, and the APIs allow you to do more deep integrations, it allows you to make the network do more and more, and sort of take advantage of not just the standards, but all of the other lines on this whole bar. So all those together really represent what the network does every day. It transports data from A to B. So the usability layer is really about making sure that when you send data from A to B, that when it arrives at B, it's actually useful. And there are really two key components of this. The first one is data transformation. And data transformation is mostly about taking data and moving it into the right format. A great example might be that you might export a CCDA that describes a patient's chart, but the receiving side needs it in a FHIR transaction in order to import it into their EHR. And so transformation is a great way to take data and make it usable when it arrives at an end destination. The transaction sequencing is about creating other transactions based off ones that are on the network. A great example is you're doing a prescription that requires a prior authorization. So being able to automatically start that prior authorization, which can speed up the whole process of getting the prescription completed, is one way you can do sequencing. And there are many other use cases where you want to make one transaction kick off other transactions. And again, both of these are really about making it so that when the data goes from A to B, it's really usable. And the last layer is this idea of optimization. And this is really forward-looking in the sense that the goal of optimization is to make the network better tomorrow than it is today. It's about improving the network. So the first thing is data quality, which is about measuring the quality of data that is sent across the network and then working to improve that quality. Whenever a participant puts better data on the network, everyone benefits from that. The quality of the data on the network is really essential to the quality of that network and how usable it is. So having a means to measure the quality and then help participants increase their quality really makes the network better every day. So measurement and reporting is about measuring and watching how the network is being used and what things you need to do to make the network more functional in the future. And so there's lots of work around determining how transactions happen, when they happen, how to handle peak loads and things like that. And all of that really is designed to make the network so that it's constantly improving. And the last box really covers almost this entire slide, which is the idea of the deep technical support of understanding all the questions you might have about any one of those boxes. Because having the boxes there is one thing, but being able to use them sometimes does require a technical support. And so having that technical support makes it possible for someone when they're using the network to make the best use of all of this great functionality. So all of this together really defines the functionality you want in an awesome network. It's really a definition of what you want to see. But below all of this, there are sort of three fundamental pillars that make all of this possible, and we'll dig into those next. Next slide, Melissa. So we're going to start with reliability. So there's reliability, security, and scalability, and all three of these define sort of key things that you want to have in a network. So we'll start by zooming into reliability. Next slide. So reliability is pretty easy to define from the point of view of someone using a network. Reliability is about the network being available when you need it. If it isn't available when you need it, it's not reliable. It's very, very simple. And while there are lots of metrics, the simplest one is really, is it available when you need it? And the goal of reliability in terms of our network providers, making sure that not only is it available when you need it, but that the transactions complete as you expect. And so the question is, how do you make a network reliable? And so we'll dig into that a little bit. Next slide. So first, we'll talk a little bit about, is the SureScripts network reliable? Our uptime in 2018 was 99.99%, which is an extremely, extremely good uptime. Just sort of as reference, Google's Gmail for 2018 was about 99.95, and Facebook in 2018 was about 99.92. So 99.99 is an extremely good uptime, and it's a great example of the dedication required to make a network that's reliable, that's always available when you need it. So let's talk a little bit about how do you get that kind of uptime number. Next slide. So there are a couple things that go into this. One is this idea of this active data centers, which is this concept that we have sort of two of everything running in both of our data centers all the time. And really the goal of active approaches, and it's kind of a common phrase we use inside of SureScripts, is that it makes sure that our problems aren't your problems, which is to say that if there were a problem in our network, if there was a problem with a data center or with a server or with a network, it's a problem that you don't see. It's a problem that isn't exposed outside of the network. And so this idea of having these active data centers, and even within the data centers, there's duplicates of everything. And all of these duplicates can all sort of run the network at its full capacity. It's really key to do this, and it's one of the things that gives you that 99.99% uptime. I think with a single data center, it'd be very, very difficult to consistently have that kind of uptime number. Next slide. And so along with that idea of the active data centers, you have this proactive monitoring and failure analysis. And this is really key for being able to predict failures before they actually impact the network from the outside. Oftentimes you can monitor and you can know that something's wrong. And it's a good tenet of network management to know something's wrong. But far more important is knowing when something's going to be wrong in the future. In other words, looking for trends that are slight problems now, but may grow into big problems later, and being able to fix those or mitigate those before they turn into a big problem. And really proactive monitoring is almost as important as building all this active structure, because it allows you to look into the future a little bit and prevent things from happening. Next slide. So reliability, it's about being there when you need it. So let's talk a little bit about security. Next slide. So security is something that everyone wants. They want to know that their network is secure and the data they send is secure. And the judgment of security is really quite simple. It's have you been broken into? Has your data been stolen? And in some cases, it's really a yes or no. But the work to make yourself secure is far more complicated. There's a lot more moving pieces to it. And so we're going to walk through a couple of the different areas that we focus on security and talk about why those really enable you to have a secure network. Next slide. So the first area I'll talk about is this idea of security standards. And these are really the certifications that we as a network work to achieve and work to improve on. And these standards have been around for a while. But what's most interesting about these standards is that over the years, they've changed to not just a list of things you should do, but they include actual on-site, real-time auditing to make sure that the things you say you do are actually happening. They have a lot more structure around how you report things that you were doing before that you're changing. And overall, the strength of these certifications has really changed in the last 5 years, to where to keep these standards up to date really requires a tremendous focus on covering the really broad range of security. And so having all of these certifications is one step, to being in a very secure network. Next slide. Now, I think that having the certifications is one part of it, but I think that this is the real key to having a secure network. And I'll start with a slight story. many of you might remember that about 5 years ago, Target had a security breach that affected a significant number of their customers, about 190 million. And that's somewhat of a telling story because that breach happened as a result of someone getting into the Target network through an HVAC vendor, so a vendor that was working on the air conditioning. And it was a very small, obscure hole that was used to get into the network, which then grew once they were inside into a massive breach. And perhaps the most telling thing about that particular scenario is that it demonstrates that the key to security is always looking for that weakest link, fixing it, and then finding the next weakest link. You're never going to find them all. There'll always be more. And you have to be very, very broad about that search, that you're looking for threats at every level. You can't just have great virus protection and great network scanning. Those are required, but you need to have great controls over all of the avenues into the network. And really, it's a tremendous focus on always understanding that you're always looking for that weak link, fixing it, and then finding the next weak link. And I think that strategy, the idea of that focus, really is what builds a secure network, is knowing that every day you have a whole new job to do to keep the network secure. Next slide. So we have reliability about being there. We have security about keeping it safe. And the last is scalability. And scalability is, again, it's a really future-looking thing. The concept of scalability from the point of view of someone using the network is knowing that the network will be there when you need it and that the network will grow with you. It's about the network being able to scale as your business scales. If you decide to use a network, you're sort of investing your business in that network. You're relying on that network to do your business. You want to know that as your business grows, as the industry grows, that the network is always a step ahead of you. It's always ready for that next transaction. And so we'll dig into a little bit about what it takes to be a scalable network. Next slide. So first we'll start with, have we scaled? And the answer is yes. Look at that 6 billion to 17.7 billion transactions in 2018. I think so far in 2019, we did about 13 billion just in the first half of the year. And so this scale has been continuing. And of course, it goes across all of these different kinds of transactions. And that's particularly important because it isn't just one very narrow focus. It's a broad range of different types of data and different types of things moving, having all of those scale over this time frame. And really, scalability is about being able to actually scale, not just a theoretical scale, but showing that you have scaled. And this network has clearly demonstrated that. Next slide. So in terms of how do you know that you can scale in the future, there are a couple of really key things. In our case, I think a workforce is a really key part of knowing that you can scale in the future. Having a really diverse and innovative technical talent source, having locations across the country so you can tap into different employment pools. The unemployment rate for software engineers is extremely low. And so having that ability to grab talent as you scale is an important thing. And then the last part is having a really good agile process and sort of a development process for making it possible to be ahead of the curve, to have software that's running faster than it needs to be so that it's always ready for that next transaction. Next slide. And so this slide is interesting because the top three logos, the Hadoop, Cassandra, and Kafka, are logos that you may have heard of before, you may not have. They're not certainly household names. But the bottom three are things you heard of before. And so Hadoop is a technology, a database technology that we use that was developed by Google. Cassandra is a technology developed by Facebook. And Kafka is a technology that is contributed to and widely used by Netflix. And of course, those names, Google, Facebook, and Netflix. And those names are synonymous with massively scalable networks. And these technologies are all part of how they do that. And we utilize all three of these technologies in the SureShips network. And it really is a key thing because those technologies have underneath them this cluster technology that really is designed for scalability at an immense scale. And so when you combine all of those together, it really is a key component of what makes a network scale. And I think that's it. Next slide. So that's everything I have about our network, and I'm always happy to answer any questions or answer anything you need. So thank you.
Perfect. Thank you so much, Jeff. So we have a few minutes. Let me check the chat box and see if we've got any questions. So it looks like there's a couple of them that came in. So let me see if I can address them for you all. So the first question was, who do you think needs to lead the push towards not using the fax machine? So that's a really good question. So I will give you my personal answer, and I think it's one that as an industry is probably true, and that is we all have to. So the fax machine happens because it exists at doctors' offices, within health plans, within pharmacy benefit managers, within pharmacies. Basically, everybody in healthcare still owns fax machines. And so similar actually to to the network concept, if you always have somebody who's sending and somebody who's receiving. So we're in this cycle of, well, then you always have to keep the fax machine, so you keep using it. And so I think collectively, we as an industry have to work together to move away from the fax machine, because while one can, if the receiver or the sender of that information still uses the fax machine, everybody's still going to have one available to them. So I think that there are, in parts of our industries, health plans certainly are taking a lead, where we are pushing our industry forward with this move to not using a fax machine. But I would say the answer is really, we all have to really make a concerted effort to think about how do we move away from this particular technology into more current technologies. So it's a great question. Let's see. The other question looks like it's more directed towards the clinical direct messaging platform solution that I talked about. And the question is, what types of messages can be sent? It's a great question. The answer is actually any. We tend to see clinical direct messaging used for things like immunization notifications, just kind of general notifications, potentially location of care changes. Even plan changes can be communicated via clinical direct messages. And then there's kind of a follow-up question to that, which is, can the change of medications be done through clinical direct messaging? So yes, however, we ideally see any kind of change to a medication happening through the e-prescribing technology. So there are transactions within that standard, such as RxChange or Cancel Rx, that allows pharmacists and prescribers to exchange information back and forth within the e-prescribing transaction set. And it allows for things like a prescriber requesting to cancel a prescription they sent in, or a pharmacist requesting a change, maybe it's to a therapeutic alternative that costs less, or some other reason, back to the prescriber. So those two transactions are ideally where we see something like change medications being communicated, but certainly clinical direct messaging can be used for that. And we really see the adoption of those individual transactions growing as we, as an industry, move to the NCPDP script standard 2017-071, which is happening at the end of this year. And so we see that adoption really growing. So ideally, those are the transactions that we would move the change medication to. So let me take a quick look again at the chat box. It looks like those are the two questions that you all had. So I want to just close today with, again, thanking you for your time and for your interest in our webinar today. I hope that it was informative and a little entertaining, as Ferris said in the beginning. And if you have any additional questions for SureScripts or for any of us, please feel free to reach out to Ashley Fifield. Her email address is here on the screen, and we would be happy to talk with you further about anything that we've discussed, or to get you in contact with the experts within our organization. So with that, I am going to turn it back over to you, Ferris, to close out the webinar.
Thank you, Melissa, and thank you, Jeff. We appreciate the presentation today, and especially that underlying concept of moving healthcare into the 21st century and using the technology that we have to better support prescribers, pharmacists, consumers, all of us. I'm still, Melissa and Jeff, shocked in my mind that half of the healthcare transactions are still via fax. I remember long ago hearing simplicity is the ultimate sophistication, and it's fascinating that SureScripts has taken something that is really pretty complex and made it operationally very simple. So thank you, Melissa and Jeff, for sharing those perspectives. HCG's overall theme is guiding healthcare executives through innovation, change, and growth, which we've talked about today. We will continue our discussions with an executive leadership luncheon and roundtable during the HLTH conference in Las Vegas on October 30th. The topic will be flying the plane while building it. Do you have what it takes to pilot the transformation of healthcare? You can register for the roundtable at hcg.org/ELR for Executive Leadership Roundtable, or email Juliana Ruiz at jr@hcg.org for additional information or for a discount code for the HLTH conference. In addition, in our webinar follow-up, we will share with each of you a link to participate in the HCG 10th Annual, and it's a National Industry Pulse Survey, where you can anonymously provide your personal and organizational insights on the challenges and opportunities facing healthcare in 2020 and beyond. The survey just takes a deeper dive into the 2020 HCG Top 10 list that was voted on and ranked at our annual forum a few weeks ago. We will greatly appreciate hearing your insights on the top issues for 2020. And finally, please plan to join us in our ongoing discussions over the next year via LinkedIn, Twitter, and our biweekly newsletter. We would also extend to each of you an invite to our 32nd annual forum in Boston on September 21st through the 23rd next year. Thanks again to SureScripts for sponsoring HCG and for leading this lively discussion. And thanks to each of you for participating. Have a great day.